Fantastic. Well, good morning, everyone. It's always great to be here in the Great Ward 8 and to be with all of you to talk about what's something that is very serious, but also to talk about the steps that we're taking to improve the wellness of residents of the District of Columbia. So I'm joined today by the Deputy Mayor for Health and Human Services, HyeSook Chung, also the Director of the District's Department of Behavioral Health, Dr. Tanya Royster, and Chief Gregory Dean is not here. So where is Assistant Chief Ed Mills? Right there. I'm looking right at him. I know who that is. And our Chief Medical Examiner, Dr. Roger Mitchell, our Senior Deputy Director at the Department of Health, Michael Carfin, as well as the Chief Medical Officer for the Department of Health, Travis Gales. So let me talk about something that is very unfortunate for us in the district in many cities, suburbs, and rural areas across the United States of America, and that is the opioid epidemic. And we have seen communities across our nation visited by unfortunate opioid addiction and fatalities related to opioid use. So it's important for all of us to remember that opioid use and death can happen to anyone, a teenager, a citizen, a senior citizen, a student, a professional, anybody. It crosses socioeconomic lines and knows no racial or religious boundaries. It breaks up families of all kinds, and it is destroying promising futures around our nation. And that's why we must work together to curb this growing problem. Today, we are here to discuss the many ways we are reducing the number of opioid overdoses in our city and helping fellow Washingtonians find freedom from addiction. The district funds already therapy, which uses various medications to treat substance abuse, but now we are working to increase the number of physicians who just prescribe it. We were recently awarded a $2 million federal grant for prevention and recovery efforts that will help us meet this goal. And Dr. Royster will tell you a little bit more about that. Lastly, education and awareness are key tools that help us ensure that we are preventing deaths related to opioid overdose. Throughout the summer, we will work to educate more Washingtonians on the availability of Narcan and on the new and very real dangers of drug compounds that pervade our streets today. We'll also work to increase awareness of the ways to recognize the signs and symptoms of overdoses, what to do in the case of an overdose, and how to connect to intervention treatment resources across our city. And we're standing in one such place where residents of the District of Columbia can find treatment and services. People with addiction disorders are among the most vulnerable DC residents, and we care very deeply about their health and well-being. And so I want all of those who are suffering to know that they are not alone, that there are services in the District of Columbia to help. And we will continue to support broad and coordinated efforts to do exactly that. So now I want to turn to our Chief Medical Examiner, who unfortunately has had occasion over the last months to really monitor trends across the District of Columbia related to opioid death, and is helping lead with our doctors, our other doctors, our public health response. Dr. Mitchell.
Thank you, Mayor. As the mayor indicated, there's an opioid crisis in this country, and Washington, D.C. is unfortunately not immune to this epidemic. However, the epidemic looks a little bit different in our city. Our opioid overdose deaths are primarily found among black men ages 40 to 60. There's been an increase of opioid deaths from 83 in 2014 to 231 in 2016. We have about 106 of those deaths to date in 2017. The wards most affected are 5, 6, 7, and 8, with 7 being affected the most. These are our fathers, they're our uncles, they're our brothers, they're husbands that are already suffering from the chronic disease of substance abuse. They're overdosing and dying because of the presence of a synthetic opiate being included in or replacing the heroin supply, most notably fentanyl. How it works is that this opiate decreases pain, but it also affects our ability to breathe. The more potent the opiate, the harder it is to breathe. Fentanyl and its other synthetic counterparts are 50 to 100 times more potent than heroin, and in some cases 1,000 times more potent. So the Office of the Chief Medical Examiner and the Department of Forensic Sciences have partnered to test the contents within syringes of needles found on scene. The results from these syringes are being compared to results from the body and those who have died as a result of an overdose. So this is an innovative approach here in Washington, D.C. It's intended to identify emerging synthetic compounds within the city, and it also gives us a glimpse into the composition of these drugs being marketed as heroin. The initiative also gives us insight to how the body metabolizes these synthetic drugs. So the bottom line, as our mayor suggested, is that we must communicate the dangers of opiate use and meet this public health issue with the necessary education, intervention, forensic science, and treatment that's required to eradicate it. Thank you, Mayor.
Thank you. Now I want to introduce Dr. Royster, who is going to further talk to us about our treatment and services available in the district and our new initiative around Naloxone.
Thank you, Mayor Bowser, and thank you for your continued support and encouragement. At DBH, we believe that every resident is valued and valuable, and your efforts and continued support in these types of activities continue to show your commitment to that. For DBH, for people who are struggling with recovery from substances, the message that we have is that there is help available and there is hope that you can recover. There is one simple phone number, 1-888-7-WE-HELP. The Department of Behavioral Health has a robust array of treatment and recovery support services, and we contract with more than 30 providers across the district to ensure that whatever service you need is individualized to where you are in your recovery journey. Whether you're acutely intoxicated and need detox, whether you need residential, whether you need outpatient services, we have the services that will meet your needs. We are learning from the people that are seeking service from us that heroin has now become the second most reported substance use in the district, only second to alcohol. It has now surpassed cocaine, which used to be number 2. So we're very excited, as the mayor mentioned, that we have been awarded this $2 million for 2 years federal grant to begin to increase our efforts, expand access to medications that assist people in remaining off of heroin, and providing public awareness and interventions to help prevent the deaths that Dr. Mitchell just told us about. 2 things that we'll do with the grant that we'll be able to add to our service system is, one, we'll be able to provide care coordination, because we know that many people who have chronic substance use disorders also have chronic medical problems that have not been addressed. And so we'll be adding additional care coordinators to the service system to support our providers in the community who are working with these individuals and getting them connected to the medical care that they need. We'll also be adding a public awareness campaign specifically targeted at 2 populations. One is the user that Dr. Mitchell just described, the older African American male who has been using for a long time and has heard the message for a long time that drugs are bad, but they continue to use. So we'll be looking at some innovative messages and new ways to reach that population and encourage them, number 1, to seek treatment, and number 2, to save their lives and use these Naloxone kits. The second population is, as Dr. Mitchell said, across the country we're seeing problems with prescription opioid use. Fortunately for us, it is not a huge problem in the district, but we are starting to see some peaks. So we will begin a campaign aimed at that message early so that we do not have the same problem that the rest of the country is having. We're very excited about these campaigns coming up in the fall, and we're looking forward to bringing them to you. Again, we want to thank Mayor Bowser for her vision of mental wellness and physical health, that everyone deserves to be valued and valuable in the District of Columbia.
Thanks, Doc. Thank you. And now I think Dr. Gales is going to join us for a demonstration. Thank you, Doc.
Thank you, Mayor Bowser, for your leadership and support. And thank you, special shout out to one of our community partners, Family and Medical, Dr. Hamilton. Thank you for hosting us today. We're very fortunate to have two great community partners as a part of our Naloxone pilot program, Family and Medical Services, as well as HIPS. The placard behind me highlights some of the successes of the program. We have distributed over 1,000 kits in the last year since inception of the program last summer. And as per reports from both of the sites, we've seen nearly 300 overdose reversals secondary to the distribution of these particular kits. And our goal and aim is to increase access through this program and increasing access to support other venues to provide over 2,000 kits in the next year. And in her absence, also a special thank you to Dr. Nesbitt for her leadership and support from the Department of Health. Now, before I show you how to use one of these kits, I want to make sure everybody understands a little bit behind how opioids work and how they cause overdoses. Dr. Mitchell mentioned that there are a series of different receptors. We won't get into the biochemistry behind all of that today. In terms of how it works. But basically, opioids love what's called a mu receptor. Mu receptors work in our nervous system. Opioids are effective against pain, so it helps work with the pain pathway. There's a pleasure pathway in the central nervous system. It's part of the gastrointestinal tract. You've seen an increase in commercials for opioid-induced constipation. It's because the mu receptor influences gastrointestinal motility. Now, the last component, though, is the respiratory system. This is what kills you. Mu receptors help regulate breathing. When opioids tightly bind to that receptor, you can't breathe. And what happens when you don't breathe? You don't get oxygen, and without oxygen a long enough time, you stop breathing. So naloxone comes in. It's effective at pushing the opioid off that receptor and helping restoring that breathing process, which keeps you alive. Now, dependent upon the drug of choice, as Dr. Mitchell mentioned, something that's really, really strong and tight and has affinity to that receptor, it's harder to push off, which is why sometimes individuals using naloxone, it takes multiple doses to restore and get an effect and a positive influence. So with that in mind, each of the kits that we distribute as part of the pilot program have 2 units. And just to demonstrate the ease of how this is done, each unit has a medication information pack that talks about some of the very same principles I gave you, as well as potential side effects. But the unit is very simplistic. It's like any nasal spray. You insert into the nostril. There's one push, and the spray is administered into the body. The medication is allowed to do its work. Again, this is the method that we have selected for this program due to ease of delivery, as well as the opportunity to increase outreach to individuals. And as I said, the information shows that it has been successful so far, and we look forward to working with our current community partners as well as expanding with other partners to increase access to residents of the district.
Okay, I'm going to invite Dr. Royster, Dr. Mitchell, and Dr. Gales to return to the podium. And Chief, do you have something to say for the fire department, Fire and Emergency Medical Service?
This is really a great program. This being a great program, many times we arrive on a scene, we find people out in the streets and alleys, various locations throughout the city that are unconscious. They've been there for a while. By putting this type of medication in the hands of lay persons that can administer it quicker, we get there, and based on the type of synthetics that are used in the drug itself, This may be enough to keep their respiratory drive going until we can get there and provide further treatment. So this here, I believe, is going to be a proven effective method to continue to save lives in the district. Thank you.
Thank you, Chief. Okay, we'll take some questions on topic, and if they're off topic, I'll take those. Yes, ma'am. Just identify yourself, please.
I'm Rachel Jason from the Washington Post, and I just wanted to kind of clarify. So the kits are given to community partners, and then those community partners can give them to third parties who can administer, or is it administered?
Okay. Let me, Dr. Gales you're from the Department of Health, correct? Yes. Okay, so he'll talk about how we distribute it specifically to the partners and everybody in the district who's authorized to use it.
So the two pilot sites, the two sites that are part of the pilot program are Family Medical and Counseling Services and HYPS. So all of the individuals who have been identified from those organizations to provide outreach have to go through a certification training through the Department of Health, where we talk about the epidemiology. We use some of Dr. Mitchell's statistics as well as statistics from FEMS in terms of non-fatal transport secondary to opioid overdoses. And we share with them trends in the district. We update it monthly so that they're aware of those trends, also including in terms of if we notice any changes in the drugs that are being used in the community. The second part of that is we talk through some of the biochemistry, the basic biochemistry, some of the stuff we talked about, the different receptors, so that people have an understanding of why overdoses happen. And then the third part of it, we talk about the comprehensive plan, all of the different components here, as well as we do a little bit more in-depth demonstration with video support to talk about how this is used so that they can then go back in to do the outreach with their clients and community folk to show them how to use it.
So, Doctor, let's just be clear about how this kit gets in someone's hand.
Sure. So each of the agencies have different criteria in terms of trying to provide outreach to their clients. And so they have systems in place in terms of identifying individuals who are at high risk to then provide the kits to them in their outreach services. So, for example, Family Medical utilizes this technology in their mobile units, where they also do syringe exchange as well to distribute to their clients.
I've done a couple stories about carfentanil and how in Anne Arundel County, counties farther out, are seeing more and more of that. And as you know, that takes more than one dose to pull you back. Have we seen any of that in the district? Are you worried about that because this is only one dose and people might need more?
Sure. So I'm actually going to defer to Dr. Mitchell to speak more about the carfentanil aspects. But in our training, we actually did a training this morning. We have introduced that to folk to let them know that it is there. And part of the training is we emphasize that when using it, whether it's carfentanil or any other substance, to continue to reassess the patient to determine if they need more administrations to then provide those services, as well as calling 911 to make sure that they are on the way to be able to provide any additional life-saving services needed that the particular person can administer to the client there.
And the kit includes two, right?
Thank you. So we've had one confirmed case of carfentanil in the District of Columbia, carfentanil death in the District of Columbia. One of the reasons why we're doing the syringe wash initiative is to identify whether or not carfentanil is in these syringes, because it's not clear how carfentanil is fully metabolized in the human body, and so we want to make sure that we're using every aspect. So there has been only one confirmed carfentanil death in the district.
Rich Reed from Channel 7. Why fentanyl versus heroin? What's going on? Why are these dealers dealing heroin or fentanyl rather than heroin?
There is an ease of creation of fentanyl. It's a synthetic compound. It can be made versus heroin has to be grown and manufactured. So there's some ease of that. And so then it's how it's getting here is a law enforcement question, and why dealers are utilizing this method. It's not even clear whether or not the dealers know that it's in their heroin supply. What's most important for this communication is to let our patients know, to let our families know that it is indeed in our supply, and there is no dose that you can take that is safe. There is no safety in heroin use in this country any longer. So every opportunity we need to save a life.
Anything else? Yes, ma'am.
Great question.
A date?
A date question.
Okay.
When did heroin become the second most used substance in the district? Was there a concrete point, or is that just?
During our data, it shows sometime at the end of 2015, early 2016, it surpassed cocaine as the second highest substance use.
So I want to be clear about all the things that we've covered today. You heard our chief medical examiner talk about some surveillance that his office is leading to make sure that we're identifying the different drugs that are showing up in our city, and that we know is going to be very helpful to the work that we do. You heard Dr. Royster talk about all of the programs and services that are available to our residents throughout their journey with addiction, and we certainly want them to avail themselves of all of our programs and services. We also talked about our efforts to better educate the public in two populations we're very concerned about. And the first population that Dr. Mitchell and Dr. Royster talked about are people in our city who may have been using heroin for decades. Let me just be frank. They may be long-term heroin users. And the message that we're sending them is there are different drugs in the supply, and these drugs you cannot manage. One use could kill you. And so we want that to be clear. We want their friends and family to know that they can come to us for services. There is an emergency medicine that may be able to reverse the effects of the opioid, but maybe not. And it could kill you. So we want everybody to be perfectly aware of that. We will also be sending messages because, as Dr. Royster said, we have not seen the same type of experience that the suburbs and rural areas have experienced with prescription opioid addiction causing fatal deaths. But we want to get ahead of that if we're able. So we're sending that message as well, that we know that the threat for prescription overdose is prevalent. And we, like I shared with the governors when we were together in Maryland a few months back, we want to work together on all of the strategies that can overcome that epidemic here in the District of Columbia. I think Dr. Gales also and the chief made an important point that we still want you to call 911. Okay, 911 is not the police. They're not going to, it is the police. Let me be clear. But if you say you have a medical emergency, and let's be clear, that's what this is, a fire and EMS officials will come and render aid and get you stable and get you to the types of services that you need. So we are very serious. We're going to more than double the amount of Naloxone kits available to the district. I'm sure the Department of Health will be seeking additional community partners as well to make those materials available. It's a serious issue. We have a serious program to help combat it, and we look forward to working with everybody gathered here today. Thank you. All right. Very good.